Hello and welcome to one and all. In today's class, we'll discuss about the population policy of India. In the previous class, we have checked out what are all the causes for overpopulation and what were all the measures to control the overpopulation, what are the programs adopted by the government of India, including the family planning programs, isn't it? So now the next is population policy of India. The question is, what is the need? The government has already announced implemented the family planning programs. Then what is the necessity for the government to announce a fresh population policy in India? Okay. See, as I mentioned, the government of India, the first country in the world to officially adopt family planning techniques to control the population growth in the year 1952. Okay. And Simon, if you remember, 1951, the first 5-year plan was launched. Okay, so what is the reason for implementing the 5-year plans for economic development? So each country has their own methods, techniques for economic development, and India adopted planning as a technique for the economic development of a country. So, and simultaneously, 1952, the government announced the family planning programs also. And what the government thought was, like, if the country is progressing economically, then automatically there will be awareness among the people and they will restrict the size of the respective families, and in due course the population of the country will be controlled. Okay, so if you remember, the family planning program in our country is voluntary, and when the government first announced the family planning program in 1952, if you remember that one day through the various methods of persuasion, indirectly the government was persuading the population through media, through cash incentives, etc., isn't it? So because the government thought that much is enough, because simultaneously all the programs were being implemented by the government in order to develop the country economically. So side by side, if this is also implemented by the government, so the family planning and economic development, they both go hand in hand, and in due course of time the population of the country will be controlled. But then by the next between 19, if you remember the data, 1951 to 1981, what happened? Our population, the rate of growth of population grew at an alarming 2.14%, isn't it? Because we entered in the second stage of demographic transition. The other day I was explaining, we were well into the second stage of demographic transition, experiencing what the economists call as the population explosion. So then it was realized that two things were realized by the government. One thing is the progress of economic development, whatever the strategies adopted by the government for the development of the economy through 5-year plans, is not ensuring the family planning, the restriction of growth rate of population in the country also. Okay. And another thing is that the government was just announcing what are all the methods, the cash incentives, preferences in employment in government jobs, isn't it? Only these were all the programs announced by the government through family planning. But then it was realized that only these methods is not sufficient. Okay, so it is, the family planning program, it should be integrated along with other health programs of the country. So basically the need to announce population policy in our country. So as I mentioned, two things. One is between 90, or let me put it at, by 1970s, the population was growing at an alarming rate. So this, the government understood that, just like, concentrating the economic development of the country, the population will not be controlled. So the same thing the government assumed even for poverty also. So till 1970s, the government did not tackle the problem of poverty directly. So if the economic development takes place in the country, the problem of poverty will also be handled. But during this period of time, even the poverty in the country was also increased at an alarming rate, more than what it was during the British rule. The same thing happened for the in population also. So then it was understood that the government need to take separate measures directly on both on poverty as well as on controlling the population of the country. I think both population and poverty, if the population of the country is more, automatically the poverty will also be more. And in our country, it's vice versa also. If the poverty is more, the family will increase the size of the family, their size. The other day we have seen, isn't it? So that is one thing. By 1970s, the population was growing at an alarming rate. And also, it is the country needs an integrated, something called as integrated, or what you call as a comprehensive family planning techniques. Meaning comprehensive family planning techniques in the sense that everything should be, the health sector should also be, the health standards of the country should also be uh, included in the family planning program. It is not just enough to give the award cash prizes or give preferences in the jobs, etc., etc. And the most of the time, the family size is increasing because I already mentioned you, the IMR is very high in the country. So unless that is prevented, or if the government is providing the proper child health care, and apart from that, other health standards also in the form of vaccination, in the form of immunization, in the form of educating the people. So all these go hand in hand. It is not just enough to just announce these are all the family planning programs, announcing through the media and all. So the government realized that it is not sufficient. So the country needs a comprehensive, integrated or comprehensive family planning program, that is including the other programs of the country like education and health sectors. So taking care of the maternal mortality rate, taking care of the infant mortality rate, taking care of the nutritional values of the, providing the nutritional requirements to the poorer sections of the population, and proper educational accessibility and facilities to the population. So all these are required if the country has to be successful in the family planning program. Okay, so that's why in 1976, the government first announced the National Population Policy. So 1976, that is, it coincides with the fifth five-year plan. Fifth five-year plan was between 1974 to 1978, only 4 years for five-year plan. Okay, so from the first five-year plan to till fifth five-year plan, the government did not tackle the problem of overpopulation directly. Then only the rate of increase in the population was alarming rate. So for the first time in the fifth plan, that is in 1976, the government thought a more in-depth approach is required to control the population of the country. So more comprehensive approach is necessary. That's why the National Population Policy for the first time was introduced by the government in 1976. So whatever the family planning program which is being adopted in our country is, as I mentioned, including all the other programs. So that approach is called as the Cafeteria Approach. So meaning, to put it very simply, it is not just one program. Several programs have to be included in this if the government wants the family planning programs to be successful, and if we have to control the growth rate of population. So it is called as the Cafeteria Approach. Okay. So this is the need for announcing the population policy in the country. And as I mentioned, the 1976 first time the National Population Policy was announced, and very recently the latest one was announced in year 2000. So National Population Policy 2000. This is the recent population policy announced by the government. So with the government fixed certain targets. So if the family planning program to be successful, if the government wants to control the growth rate of population, so some targets, some objectives were fixed by the government. So basically, 3 objectives were set forth by the government. So 3 objectives. One is immediate objective, in the sense that immediately there are some problems which have to be tackled immediately and which can be tackled immediately. So the immediate objective, what the country has to do is to meet the needs of contraception. So this can be dealt immediately. Those techniques, those pills have, they are that medical kit is provided by the government. So to a certain extent, it will control the growth rate of population. And most importantly, health infrastructure, in the sense that better hospitals and clinics should be available, including in the rural areas. Okay, and then health personnel. So not only the hospital, the required amount of doctors, paramedical staff, all those health personnel should be available in the country. And also, I mean, we can also include and provide better healthcare for mothers and children. So because the maternal mortality as well as the infant mortality, both are very high because they are the vulnerable sections of the population. So this indirectly, this is also a reason for the growing rate of population in our country. Okay, so this, I mean, you can understand this. All this can be provided immediately, and this cannot wait for a long period of time. So this is the immediate objective of the national policy, population policy 2000. Then there is something, the medium objective. The some of the objectives that can be postponed to a certain extent, or what you are called the medium term objectives. Okay, medium term objective is to reduce the something called as the total fertility rate to 2.1 by 2010. Okay, I mean, the meaning of fertility rate is what is the average number of children that could be born in of the entire lifetime of a woman. So that means we put it the average number of children that would be born to a woman over her lifetime. So normally the lifetime we're saying, but then the reproductive age is somewhere between 16 years to 35 years. So that's why the child marriage has to be prevented. If the child marriage is early, the woman gets married, the reproductive age keeps prolonging. So there will be increase in the birth rate in the country. Okay, actually, the total fertility rate in it was 3.2 in 2000. So that's why it has to be reduced to by 2000. The goal is by 2010 it has to be reduced by 2.1. And this is in 2000, as I mentioned, 2010 2.1, and 2000 as of 2000 this is the target. Okay, but As of 2013, it is 2.3. So that means what is it? If I say 3.2 on an average, I mean 0.2 is just decimal, you can ignore that. So 3.2 means on an average, 3 children per woman. So the government wants to reduce that to 2 children per woman. So that's why we are having the 2-child norm, isn't it? So that has to be implemented by the government. So that is a medium term objective. See, you can understand that this, it takes a certain period of time. It is not like providing the better infrastructure or distributing the contraceptives, etc., to the people, isn't it? So that's why this happens to be the medium term objective. Okay, then afterwards, the third one is the long term objective. So the long term objective is to stabilize the population by 2046 AD. To stabilize the, how the population will be stabilized, what is the this is what is happening in all the developed countries. So if you can stabilize the population, one day if there is low birth rate accompanied by low death rate. So this is, isn't it, this is the third stage of demographic transition which all the developed countries are experiencing. So they have stabilized the population. So this is the final objective. By it has to be achieved by 2046 AD. Okay. Now let's move on to what are all the, it's based on these objectives, what are all the features of the national population policy of 2000. So features of national population policy 2000. Okay. So the first feature is reduction of infant mortality rate, that is IMR, to below 30 per 1000 live births. This was the target set in 2000. Okay, and the other day I mentioned to you what is the have you achieved this target? If you check the data, you will understand. So it was actually 44 infant mortality rate in our country was 44 per 1000 in 2010. Okay, and decreased to slightly 37.8 per 1000 in 2018 compared to world average of 28 per 1000. So that means what the target is that still we have as per 2018 there isn't data, still it is not, we have not decreased to below 30. Okay, so anyway, that is the first target. So there is a close connection between, as I mentioned, because of the high infant mortality rate, the parents are not sure to take care of them in the old age. So the size of the family increases. So if the infant mortality rate is controlled in the country, automatically the family will understand and then they will restrict the size of the family. And children, they are the more vulnerable to diseases and death. So for that, proper health care in the country has to be provided. I think now you understand the connection. And then the second one is the reduction of another one, maternal mortality rate to below 100 per, this is actually normally we calculate for 1 lakh live births. So maternal mortality rate is a number of mothers dying at the time of delivery, okay, per 1 lakh mothers. Okay, so that's how the maternal mortality rate is calculated. And in our country, once in 3 years we are calculating the maternal mortality rate. Okay, so if you check the, it is the target is to reduce 100 per 1 lakh live births. So it was actually the maternal MMR in our country was 130, I mean per 1 lakh. per 1 lakh. This was in between 2016 to 2014 to 2016, 3 years. Based on the survey conducted for 3 years, between 2014 to 2016, on an average, it was somewhere around 130, and which is reduced to 113 per 1 lakh between 2016 to 2018. So this also says that we have not achieved this particular target also. So both are still yet to be achieved by the country. Okay. Then anyway, then the next feature is the something called as the universal. Universal means for the entire country. Immunization. Immunization means vaccination to prevent any disease. Now I think everybody must be understanding what is the meaning of immunization. COVID vaccine. See, you can understand that before the COVID vaccine was developed, there were so many deaths, not only in India, all over the world. So now there was a tremendous decrease in the death rate because the vaccinations were developed. So once upon a time, there were not vaccines for any of the diseases. Then the people were not immunized against any diseases. So the death rate was high. And as I mentioned, it was mostly affecting the mothers and children. Okay, so the vaccination has to be developed, and majority of the population in the country should be immunized against all the diseases. So universal immunization. So that has to be provided. Universal disease for the country as a whole, that has to be provided. And then the next one is achieve 80%. Let me highlight it. Achieve 80% deliveries in regular dispensaries, hospitals, etc. So this is mainly because, especially if you take in the rural area, they, as I mentioned, they are all just wrong attitudes, isn't it? They have that social backward attitudes. So most of them, they won't even come to the hospital for their delivery. So that's why the infant mortality rate and the maternal mortality rate is very high, especially in the rural areas. So in order to avoid that, it has to be ensured that most of the people are attending, coming to the hospitals for their deliveries. So even now, even this day also, we are not aiming for 100% deliveries. Still, it is only 80% deliveries. At least 80% should be done in the hospitals. So this is to prevent the maternal mortality rate and the infant mortality rate. And then access to information. These are all the basic health standards that have to be improved in the country. Access to information regarding or any communicable diseases. So now everybody is aware of how contagious COVID is, isn't it? So earlier, this kind of awareness were not there among the people. So communicable diseases, AIDS, etc. So if that information is provided to the people in advance, so automatically the preventive methods will also be, they will cooperate for any preventive methods. Okay. And next one is, we already seen this, incentives to adopt two-child. No. Okay. And next, facilities for safe abortions. So if the facility is there, then people will come to the hospital for that, isn't it? And strict enforcement of child marriage. This we have already seen. Still, we are not successful. Even today, 25% of females and 15% of males are getting married before their legal age. But that's why there should be strict enforcement of Child Marriage Restraint Act. And there is also another called as the prenatal diagnostic technique. Meaning, in our country, it is against the rule to find out the gender of the baby before delivery, isn't it? Because the reason is people are, they don't want the girl child, isn't it? Because of that, there's so many problems are happening in the country. So that's why this is ruled out in our country. We are not supposed to find out the gender of the baby before the delivery. So that all those things have to be strictly implemented by the government. Okay. And the next one is, so raising the age of marriage. This we have already seen. Uh, Actually, it is, we have seen that 18 years for girls, females, and 21 years for males. And the proposition is to make 21 years for females and 24 years for males. So still the have to be raised, the age of marriage has to be raised. Okay. And then the next one is a special reward, in the sense that cash incentives for women who marry after 21. So that's why I mentioned this is a proposition, and it has not been compulsorily implemented. Anyway, family planning, whatever the methods itself, is voluntary. So indirectly, still legally it is 18 years, but then that's why the government wants to increase to 21 years. So that's indirectly, if anybody marries after 21 years, for women, the government is providing the cash reward. Okay. And and also for any women who are undergoing the for terminal method of, that is stopping after 2 children through operation of contraception. So whichever women is practicing all this, the special award is being given by the government. Okay. Then next one, this is also very, very important: health insurance cover. So most of the poorer section, they don't have insurance. They're not working anywhere. Where will they get the insurance? So that health insurance cover should be provided by the government to people below the poverty line, so that the risk of operation will be, family planning operation will be covered, so that the risk of family planning will be covered. So if they are not sure what, because everybody will be scared, isn't it? Operation, what will happen? So if it is at least covered through insurance, they will come forward to undergo all that. And then to achieve, there's something called as universal access to information, counseling, and services for fertility, regularization, and these are all the, whatever the medical problems which the women are having, those kind of awareness should be there, counseling should be there, and also the proper treatment should also be there for the women. Okay. And finally, there's something called a bring about there's a convergence in implementation of There's something related social sector programs. So this is what it is given to make family planning, family welfare a people-centered program. See, this is what it is given, isn't it? So the meaning is convergence means it has whatever the family planning program which is initiated by the government should coincide or should complement with all the other should coincide with all the other social sector programs implemented by the government. Social sector programs, these are all the social education. So that kind of proper education should be provided by the country, the health facilities in the country, social welfare, etc. So these are all the social sector programs. So all this should be what you say, complement the family welfare program, or the family planning program should be complementing with all these programs. That's why it is a comprehensive family planning program. It should not be in the beginning I said, isn't it? We should not concentrate only on family planning techniques. It has to be a comprehensive program. So that the government has to see to it that all the programs are complementing each other. Then only the cooperation from the people will be successful, and the operation will also be successful, and we will be able to control the growth rate of population. Okay, so these are all the features of population policy. But the most important of all this is the education. Nothing can, that too especially the women education, nothing can replace the uh, effectiveness of having the proper education in the country. So the first and foremost thing what the government has to do, give the proper education accessibility and affordability to all the sections of the population in the country. So automatically is what Amartya Sen said. So once you provide the education, people themselves will know the consequences and everything, and they will take care of themselves. Okay, so this is the population policy of India. Okay, so if you find this video useful, please like, share, and subscribe. And if you have any doubts, mention in the comment box. Okay. So next one. So we have finished with the first part. So as I mentioned, this demography and human resource development. So demography, I told you all the details regarding population. So that part we have finished. The next finished, and next part is the human resource development, which I will take in my next class. Okay. So until my next class, next video, take care. Bye bye.